Hello, everyone. Welcome to the Quantum Beauty Podcast. My name is Carrie, and this is episode 8, Facial Somatic Self-Demonstration. To get started, we'll begin with defining the term somatic. Somatic is a term that refers to the body and the body's sensations, especially in relation to how the body holds and responds to stress, which is different and separate from the conscious mind. Facial somatics specifically refers to the face and how the face holds tension. It is certainly unlike the body because we have very unique muscles in the face called mimic muscles. These muscles are responsible for our ability to make expressions and convey our emotions. Over time, the tensions that are formed in these muscles will eventually form facial stress patterns that typically show up as aging skin patterns. We can retrain these patterns through facial somatic work. Facial somatic techniques work to naturally uplift the face, improve facial posture, improve blood flow and skin nourishment, improve lymphatic flow and detoxification, and overall improve skin health. It is also deeply relaxing and regulating to the nervous system. Facial somatic techniques are done professionally and go much deeper. However, the techniques that I'm going to show you today, I like to teach my clients so that they can support the work that is done in the treatment room at home. Okay, so let's get started. In preparation for facial somatic work, you will need a good oil medium. So I like to use the Dr. Alkaitis Nourishing Treatment Oil, but you can definitely use a jojoba oil or an olive oil or even a sweet almond oil. You will also need a tissue, and you'll need a moist towelette for the end. You'll also need to wear your hair up and make sure that you have no makeup on. So I will get started. I am going to use 2 pumps of nourishing treatment oil. The first pump I'm going to spread on my chest, neck, back of the neck. Just getting that nice slip that we will need. Another pump for the face. Before I get started, I like to start with breath. And the breath rhythm that I'm going to show you and implement is called coherent breathing. It's a very simple form of breath work, and typically it's about a 5-count inhale through the nose and a 5-count exhale through the nose. And you're breathing from your diaphragm. When you breathe, you want to feel your belly rise and your rib cage expand out. So I will demonstrate this breath for you. I would typically do 5 to 6 rounds of this breath before getting started. Having your hands at your rib cage, you're going to breathe in through your nose for a count of 5. And then breathe out. You should be able to feel your hands expand up and out, and that way you know that you're breathing from the diaphragm. Next, I like to soothe anxieties and activate the parasympathetic nervous system as well as the immune system through sternum tapping. And you can do this as long as feels necessary. Then let's now move into the different movements. The first movement is a pinch walk that starts at the midline and moves out to the axillary armpit. And basically you're pinching and moving the fingers over, out, to the side. Now, for the sake of this video, I'm going to do each movement a couple times. But ideally, if you're doing this for yourself at home, you're going to want to do each movement around 6 times and even up to 15, 20 times. Do the other side. You also don't need to rush through the movements. You can do them slowly and deliberately. The next movement is a chest opener in which I'm going to use my knuckles. And basically, you're working again from the midline out. I'm going to start on my left side using my right hand, and I'm just going to do circles, but moving and extending outward. Let's try the other side. The next movement is a deltoid release, where I'm going to take my right hand over my left shoulder and I'm just going to pull the muscle down, up and down, alternating hands. Just like so. Now for the next movement, I'm going to be working the occipital and neck region. And I'm going to find the C7 vertebra, which feels like a hump. It's also known as the widow's hump because this area does over time develop a hump. We typically hold a lot of tension in this area. And I'm just going to alternate my hands over that vertebra. This feels really good. And then I'm going to extend each hand up and over the neck, and I'm going to squeeze the neck like this. Squeeze the neck. Again, alternating hands and sides. Squeeze the neck. Squeeze the neck. Now I'm going to work the sternocleidomastoid muscle, and we're going to take our palm and we're going to work from the clavicle up to behind the ear, and just a long pattern, just up and over the ear. And I do this at least 6 times per side. Let's try the other side. Up behind the ear. The last neck movement is neck pinching, where you can use one hand or you can use two hands where you're just pinching the neck. If you use one hand, you can move up using one hand, or you can use two hands. Doing the other side. All right, so now we did the chest and the neck region. We're going to move to the face, starting with the jawline. I want you to take your hands parallel to each other like this, and I want your jaw bone to nestle in between the thumb and the forefinger, just like so. Add a little pressure. You're at the lateral edge of the chin, and you're just going to extend this out to the ear. Moving slowly, gliding. If you find yourself tensing in any area, I want you to start to sway or rock as you do these movements. It just helps loosen up all the muscles. Very good. Now I want you to take your thumbs and I want you to pinch the chin. Just like so. Pinching away all that tension. And little circular thumb movements. Now we're going to work the depressor muscles. I want you to take your last three fingers and just move up, stopping right about there. Adding moderate pressure. This one typically feels really good. And moving up to the lips, this is when you'll need your little Kleenex just to get off the excess oil so you can really grab onto the tissue. Using your middle and thumb, you're going to find what is called the modiolus muscle. It's right by the corner of the mouth, and you'll know you found it when you feel like a knot underneath the skin. And there it is. You're just going to take your middle finger and your thumb, and you're just going to work this muscle, wringing out all the tension. It's hard to get underneath that muscle. Working the modiolus muscle, you want to work slowly. Let's do the other side. Let's extend this to the whole mouth using the ring finger and the thumb. Very good. All right, now we are going to create a smile for ourselves, working what is called the risorius muscle, which extends from the modiolus all the way out to the bottom of the ear. So we are going to pull the tissue back, and with the last 3 fingers, we're going to glide back towards the bottom of the ear. Just like so. Now we're going to work the levators, the nasalis, all the way up and around the eye muscle, which is called the orbicularis oculi muscle. And we're going to take those fingers, we're going to extend, adding a little bit of pressure, moderate pressure, moving up around the nose, coming up around the eyes and down. Okay, I'm going to demonstrate this without talking. One more. Now we're going to work the zygomatic muscle, which runs along the cheekbone, bringing the right hand, extending it around the head. Using the fingers, I want you to lift underneath the cheekbone and just little deliberate circles. Imagine that you're moving out and you're expanding the face outward. I'm going to have you do circles under the zygomatic bone to the temporal bone, right where that TMA or TMJ joint is. And let's do the other side. Make sure most of your pressure is in the middle and ring finger, as opposed to the index finger. That particular movement can put a little bit of tension in the neck region, so just feel free to work that out when you're done. Okay, now moving to the procerus muscle. This is one of those muscles that's responsible for what we call the 11s in between the brows. We're going to take our thumbs, alternating up over that muscle. You can also work diagonally. Let's extend this out to the corrugator muscle using the middle and thumb, and just pinch right in this area, right where the brow starts. This is your corrugator muscle. I want you to pinch and hold, or you can pinch and lift because that's what we want to do. We want to lift, pinch and lift, and you can follow that to the midline of the brow and pinch and lift to the lateral edge of the brow, pinch and lift. Let's do that on the other side. Okay, first, we're going to grab that corrugator muscle and we're going to pinch and then pinch and lift, bringing it to the center, pinch and lift, and the lateral edge here, pinch and lift. Of course, you're going to repeat that at least 6 times. Remember, 6 times. Then you're going to take your knuckles and little circles. You're just going to rub over the procerus muscle and you're going to extend it to the whole forehead on both sides. There may be some tender spots for sure. And then last, if you want, you can massage the scalp, just like you're massaging, like you're washing your hair. That would be good. I'm not going to do that today, but I'm just planting that seed that you could do that. And then if you want, you can just follow with a little bit of light effleurage. This is further calming your nervous system. It's just very delicate. Bring it up to the jawline. And then take both hands and bring it down over the ears. This supports lymphatic drainage after all the work that you did. Okay, so next part of this treatment, I want you to now rinse your hands with your moist towelette, like so. Because now we are going to do a jaw release technique, really working the masseter muscle of the lower jaw. But we're going to put our thumb in the back of our mouth. And in the back of their mouth, there is a muscle that lays parallel to the masseter muscle. It's the medial pterygoid muscle. It can feel tender for a lot of people. Definitely feel tender. And then once, it's going to be hard to do this once my finger is in my mouth. It's going to be hard to talk, I mean. So once your thumb is in that area, you're going to work the other fingers over that masseter muscle. So like so, taking these fingers. Let's try the other side. Now I want you to notice how your face feels following all those movements. One thing I do want to mention also is that any type of buccal massage, it's really best to warm up the surrounding tissues before you go right into the mouth. So I do want to make that point. I think it's important. So notice how your face feels. At this point, you can wash off the excess oil, or if you're headed to bed, you can just let all those oils absorb into your skin. Make your skin really soft and supple for the night. All right, well, I want to thank you so much for watching this video. And if you would like to learn more about facial somatic work, you can always send us an email at evolveyourself@lotusevolutions.com, or you can comment within the comment section of this video. All right, I thank you for watching.